Well, hello everybody. Thank you for tuning in to this wonderful video conference. I'm Regan Burr, and I'm the founder and executive director of the Lupus Research Foundation. I want to thank our wonderful friends, Mike Dietz and Joel Dietz, who have been with us from the beginning, helped shape our foundation and grow our foundation, and really helped with the Lupus Spiel as well, our major fundraiser. And I want to thank those guys for making this video conference available today. I'm so excited. And we're so happy to work with Dr. Niewold, our wonderful friend to the Lupus Research Foundation. And he is our expert of the day that we're so proud to bring to you guys to bring us some information about this very critical time in history with lupus and COVID-19. So I'd like to introduce Dr. Timothy Niewold. Dr. Niewold is the director of the Colton Center for Autoimmunity at New York University Langone Medical Center. We first met Dr. Niewold when he was working at the Mayo Clinic in Rochester, Minnesota. We're proud to say that he is our foundation's primarily funded researcher. Dr. Niewold has spent a large part of his career on interferon, a molecule involved in the inflammatory process of lupus. His work was influential in the recent successful phase 3 human clinical trial by AstraZeneca last fall that yielded clinically significant results and may wind up as another lupus drug on the market. And that's important because currently there's only one dedicated lupus drug on the market today. Dr. Niewold continues to work on that, as well as a parallel enzyme project also showing promise, and many other excellent research projects. Dr. Niewold is a professor of medicine and pathology, a geneticist, and is recognized for important contributions to understanding how genes influence cytokine patterns that give rise to lupus. And the word cytokine will become important throughout this video broadcast. Dr. Niewold has published more than 140 papers in immunology, genetics, and rheumatology, and he is known around the world as a leading expert. So welcome, Dr. Niewold. And Mike, we're so happy to work with you and proud to know you. Was wondering if you would like to give some information about yourself and your lupus journey.
Sure, thanks. My name is Mike Dietz. I'm a friend of Reagan's for many years and a supporter of her foundation in the spiel, as she said, as well as an advisor to her. And I'm also a lupus patient myself. I was diagnosed in 1996, so I've been living with it for 24 years. It's ranged from anywhere from mild aches and pains to I've had blood clots, I've had a pulmonary embolism, I've had a stroke, I've had internal bleeding. So it's ranged from very, very mild to very serious. So the research that we support with Dr. Niewold is extremely important to me. I'm really hopeful that we can someday find a cure.
Thanks, Mike. I know you've been through a lot. Same as me, most of you guys know that I have lupus. I have systemic lupus. I was diagnosed several years ago, and the lupus attacked my kidneys. So my medication was 2.5 years of intravenous cyclophosphamide, which is also called Cytoxan. It's a very prevalent breast cancer chemotherapy. And unlike cancer patients, the desired effect for me was to suppress my overactive immune system, because that's what lupus is it's overactive and it attacks healthy tissue. I am in remission now on medication. I'm still on prednisone and Plaquenil, which is hydroxychloroquine, every day. But being in long-term remission after that degree of illness is very rare. I am the exception and not the rule. And like Mike, that is why me and Mike and my husband Todd Burr and others helped form this foundation so we could help find a cure for lupus by funding research for a cure and by raising awareness. And a cure is in sight within just a few years. And Dr. Niewold and other leading world experts say the same. So that is why we're so happy to do what we do and work with Dr. Niewold. So thanks again, Dr. Niewold and Mike, for being here, and Joel for organizing this. So with that, let's get started. Are you guys ready?
Yes.
Absolutely.
So Doc, why don't you start us off and tell us and tell everybody watching, what is lupus?
Sure. So lupus is an autoimmune condition, which is a condition in which the body's own immune system attacks normal tissues and cells. And so you get inflammation, but it's not driven by an infection or any external process. It's actually coming from within your own immune system. In lupus, this shows up in many different body systems, and hearing from Mike and Regan, you've heard about some of these already just in this segment, and it frequently attacks the kidneys, can result in stroke and other serious complications. Skin, joints, and the musculoskeletal system are very commonly involved. So it's really a condition that affects multiple body systems. It can sometimes be difficult to diagnose because different systems show up in different people at different times. So there are a number of people who have had to have a long time to receive their diagnosis just because the symptoms started off somewhat in a mysterious way, and it took a while to be finally diagnosed with lupus. The treatments are not so many. We still need more treatments, and the ones that we have are not perfect. And so I think there's reason for optimism, and there's also definitely a lot of work to do to get this condition under better control.
Well, thank you for the work you do, doctor. And what I come across is some of the things people are shocked to hear is that 1 in 210 people has lupus, which is more than MS and AIDS combined. And it primarily affects women. 90% of people with lupus are women, and a large portion of people who have lupus are people of color. And the other thing that's in the news right now is, and we'll get into this more, is hydroxychloroquine. My understanding is we need it as lupus patients to prevent flares, and it's really important to prevent flares because they can cause organ damage. So thank you for that introduction and information about what lupus is. So should we get started with our first question? Doc, can I ask you, how do lupus patients react to COVID-19? Do we know yet, based on any information available on hospitalization or mortality rates for people with lupus versus the general population? Are we more likely to get COVID? Are we at a higher risk for severe complications? What can you tell us about that?
So it's still early days, but we've been collecting this information as fast as we can, both for lupus and other autoimmune conditions. You could imagine that there may be good and bad things about having lupus as far as your risk of getting COVID. One of the study in the lab, the interferon molecule that Regan already mentioned is upregulated or higher in lupus patients, and it's sort of our defense system against viruses. So you could wonder, maybe that could be a good thing. We don't really know for sure, though, and until you know what happens in real human populations, then that's just speculation. On the other side, you could be concerned because some of the medications that are used for lupus can bring down the activity of the immune system. And so you could wonder if you have some risk of being more likely to get COVID in the first place. We don't know the answer to that yet either. We don't know whether people with lupus are more or less likely to get COVID. The information that we've gotten, I think the most clarity on so far has been from people who are confirmed and diagnosed to have COVID in the hospital. Are they more likely to have a severe case or not? And so far I can say in our own review at my center, it doesn't seem that people with lupus who have been definitively diagnosed with COVID have had a more severe course. I think the somewhat limited access to testing makes it difficult to ask some of these bigger questions about how likely is someone to get COVID if you have lupus, because we really don't probably know the true population burden of the condition in the general population or how many people have been exposed. So far I would say the data regarding whether lupus patients would get it more severely has not shown any signal, although the caveat is that it's still early days and we're still collecting the information.
Are there specific studies out there looking at something like that for lupus patients versus the general population?
Right now, the efforts are really focused on collecting the information, and so the studies are aimed at understanding how many people with a lupus diagnosis get the condition and other autoimmune conditions. Um, I think when we get antibody testing, then we'd be able to answer the question better about exposure. Right now, we can only detect active infection, so it's hard to know really the prevalence or the amount in the population, because someone who has already had it would show up as negative on the current test for active viral infection. Um, I think that we are also trying to collect blood samples to get a look at the immune response and to understand how this might differ in people with autoimmune diseases. But this is still very much in the data collection phase. I'll say in New York City, we've really been hit by this, and so we're scrambling to try to take care of the patients and do the research, but it's all a pretty new thing, and so we don't have enough information collected to really make a lot of statements. It will be coming.
So there have been reports that cytokine storms may be behind the more extreme and fatal cases of COVID-19. Can you explain first what a cytokine storm is, and is this immune response seen in COVID-19 patients similar to the immune response that is seen with lupus patients?
Yes, and that's a great question. We've been involved in the clinical care of the severe COVID patients, largely around this issue of cytokine storm. It seems that when people get the virus in the severe form, the immune system is turned on too much, if you will. There's the cytokine storm is a way of describing the really robust immune response that you get, where things are storm is probably a good word for it, where there's actually too much inflammation at that time, and the body's bigger problem for survival is actually the inflammation, not so much the virus right then. In those cases, it's been beneficial to try to bring the immune response down to some degree and to treat that cytokine storm to help people get through the severe phase of infection. For that, we've used some of the drugs that have been developed for rheumatology, for example, tocilizumab and other IL-6 blockers that were developed for rheumatoid arthritis, currently in trials for severe COVID infections. Cytokine storm is actually taken from this bigger concept of this sort of hyper-inflammatory state that can happen either in the setting of infection or sometimes does happen in rheumatic diseases. So it is correct that in some severe cases of autoimmune or rheumatic diseases, you can have a cytokine storm. In lupus, we haven't used that word so much because it's rare that you get such a robust storm all at one time, although I think the closest that you have is some of the patients with severe nephritis could resemble this. And then there are some conditions that really have a very similar version of cytokine storm that are called autoinflammatory conditions, frequently affect children. And these conditions, you see this sort of overwhelming cytokine response. But the general principle, I think there are a lot of parallels between lupus and other autoimmune conditions, and the over responsive system and what happens in severe COVID, where it's actually beneficial to bring it down. For some people, it may sound a little strange that you have an infection and you want to use something to bring down the immune system. And it's not necessarily for all COVID, but when it gets to that point that there's a cytokine storm, it's actually important to interrupt that to help the person survive.
So I guess I have a little follow-up to that, Doc, and maybe you touched on it, but so you did address, we were wondering how other people with rheumatic or autoimmune diseases react to COVID, and I think inflammation is a common factor, if I understand that correctly. But in the cases where a cytokine storm can happen, like in lupus nephritis patients, as you mentioned, if they were to get COVID, would everything with the inflammatory process be exacerbated that much more?
It's a good question, and I'll say that we only really know this from anecdotes now. Thankfully, we haven't seen that combination very often. Um, but it would be an example of the virus hitting a person at a very vulnerable time when you're already very ill. And most likely that would be a very dangerous combination. If you're already having cytokine storm, then you would likely be trying to treat that to begin with, and the COVID would definitely not help. Yeah, luckily for most of the time, people living with autoimmune conditions, you're not in a cytokine storm stage. The cytokine storm really refers to that severe critical illness, which means you're in the hospital or headed there by the time this happens. So luckily that hasn't happened that much, but I know there are some cases where someone has been admitted for severe autoimmune condition and contracted COVID as well. So it's possible. I think whether that makes it worse, I think it's hard to tell right now because it's in isolated cases. But you would presume that would definitely not be helpful when you were already cytokines.
Well, that brings me to my next question too. For those of us who are relatively still in remission or in remission on medication, and in general for all people out there, are there diets, lifestyle, protective measures that people with lupus or the general population can take, and other people with chronic illnesses to protect ourselves against COVID?
Yes, and that's a great question, and that's probably one of the most common ones that we get, I'll say, and it's right on. I guess I would start off on a fairly positive note. I think for people with lupus, is that this is going back to one of the first questions. We don't really know if people with lupus are even any more likely to get COVID than anybody else in the general population. We know that COVID is very infectious, and so whether you have some immunocompromise, meaning your immune system's down, either from having lupus or taking medications that bring your immune system down a little bit, even people with normal immune systems are very susceptible to getting COVID. So in that way, we may not find a big difference in the risk of getting COVID, whether you have lupus or not. But the main things that you can do are to try to be careful not to come into contact with the virus. And so this is where a lot of the general population guidelines are still the best advice also for people with lupus, is to try to be careful with your exposures, use appropriate social distancing, regular hand washing. These really are the mainstays of preventing viral infection, COVID, and otherwise. And for COVID being a new virus to humans, it's very infectious for us all. So for some viruses that have been around for a long time, and we have some immunity to these, and we're more prepared to handle these if we're exposed. COVID appears something that has just made a jump into humans, and that's why it's so infectious, is our immune system is really not prepared for it. And this is the case whether you're not immunosuppressed and you have a normal immune system, or whether you have any degree of immunosuppression. We're all very susceptible. So really the lifestyle parts are a lot of the things that are being recommended broadly, and those really are important. It's likely that it's important how much you get exposed. So even if you were to be exposed and not know it, but be exposed at a lower level because you were appropriately socially distancing, that's still a lot better. So I think these things are things that will keep you safe. Ideally, we will get to a vaccine and other preventive measures, but in the meantime, when we don't have that, the best medicine is kind of the old-fashioned medicine of trying not to get exposed to the virus at high levels.
So what are your thoughts on how long it might take to get to the point where there is a vaccine? I've seen estimates all over the place and heard different discussions, but what's realistic?
Yeah, I think that is unfortunately, a little bit hard to tell. On average, you'd be looking at a year, I think, from when people have already started working, so it'd be less than a year from now, ideally. It does take some time. We know a lot of how to make vaccines, and we've learned a lot through the years about how to make vaccines, but you still have to test it and make sure it works. So despite all your best ideas and making the best try at it, you really don't know until you try it in humans and see what happens. So that part can take a little bit of time. I know given the severity of this, there's a lot of interest in regulatory agencies around the world in trying to fast track anything that might be beneficial for COVID and to remove any administrative or bureaucratic obstacles along that path, which is great. So I think that everyone's on board that we want this to come soon. And I think that the part that we don't know is, which method will be successful and when will we finally kind of hit the best combination that provides the best protective immunity. So I think that's the tension right now, is trying to get a vaccine developed and figure out what other drugs might be useful for treatment. Since this is new, we're having to do this as fast as we can, and typically we have a little more time to work with for this kind of a thing, but because of the pressing need, we're just doing what we can, I think, as fast as we can now. I think that there's some reason for optimism as things move on, and that we, at least especially in the US, we haven't been able to test a lot of asymptomatic people. And I think there are probably a number of people who've been exposed and maybe not even known it and might have some protection. It could be a while before we know who those people are, but in general, that's a benefit for all of us. The more people that are not susceptible in the population, the less likely something can spread and move through the population. So, I'm hopeful after some of this first wave calms down that we'd be a little less likely to see something that severe in the future. And I think between that and social distancing, that's the optimistic note that we can get to a better place, hopefully even before a vaccine would become available.
Well, I think all of this information and talk about how the disease works and the inflammatory process also sheds more light on lupus, because it's a similar, or at least there are some similarities in that we have an inflammatory process happening. So to me, in my mind, it also emphasizes how important it is to keep research rolling, and that there's such a need for a cure, just because lupus already is life-threatening. And so, again, we thank you for your work, Dr. Niewold, and for all our supporters out there.
Yeah, it's a time that's scary for all of us, and especially scary, as you mentioned, if you already have a serious condition like lupus, and then to think about this health risk that's out there now. As I'd mentioned earlier, I think the good news is so far we haven't been able to detect any special predilection of the virus for people with lupus. So I think, we'd all like this thing to go away as fast as possible, but at least I don't think there's a lot of evidence that lupus patients are necessarily more susceptible to severe infection, at least. So that's good news. But yeah, I think that it does, the point that you raised, there's just a lot that we don't know yet in medicine and in the immune system. And I think the exciting part is that the research can really help in a lot of different ways. As we'd mentioned at the start, having too much interferon is one of the things that we think leads to lupus, and so we've been working on this quite a lot, and we're optimistic that a drug might be approved that targets this pathway in lupus. It is also one of our most important antiviral defense mechanisms, and so in this way, I'm just a big fan of biomedical in general. I think that we learn things in some areas that can be applied in other areas, and I think that the things we've learned about interferon and lupus may well be helpful as we think about COVID as well, because we've learned more about how interferon works in the human body. And it's I think that it is a time where we have to do the initial first response, and obviously we have to do everything we do medically, but I think it's also a time where it's important for us all to kind of rededicate to biomedical research. It reminds us that there are really threats out there, lupus and COVID and many, many others, that actually are dangerous and still need a lot of work to bring under control.
So one of the goals of Regan's foundation as well is to raise awareness for lupus, and that's a huge issue as well. There's not a lot of awareness out there in the general population. So when it's been talked about in the news a lot lately, you've got the media and there's all kinds of discussion around hydrochloroquine and what it's used for, and with the president of the United States actually mentioning the word lupus, it gets more awareness out there. Have you seen anything change from your end as far as more awareness, or more people asking questions, or more people looking for information from you because of what's been happening lately?
Yes, and I agree. I think that lupus is still under-recognized, and um, that's positive. That's maybe come from this is there's been a little more discussion of what is lupus from people who are curious and may not have been aware of it. I think the hydroxychloroquine question is important as well. Um, and I might just spend a little time on that and the issue of medications, because that's one of the things that we get asked about commonly. I think we've shown that hydroxychloroquine is really important in lupus. And so that's one of the things that I'll say as a physician who treats lupus patients. When we saw this being considered as a treatment for COVID, we immediately got worried and thought, gosh, we don't want to see shortages for our patients. Unfortunately, we have had a number of patients say that it's been harder to get at the pharmacy lately, and I think that looks like a fairly premature rush to judgment about whether this would work for COVID. I mean, the studies are ongoing, but it's fair to say that the results so far are a mixed bag at best as far as whether hydroxychloroquine actually has a benefit in either preventing COVID or treating COVID after you have it. That's in contrast to lupus, where there's really clear benefit of hydroxychloroquine in lupus and also in some other autoimmune conditions. So we have, through our various societies, been lobbying hard to say that obviously we support studying any drug that might help in COVID, but we don't want to see shortages for our patients, because there are a bunch of patients that really need this medication. I think we've definitely helped raise awareness in that way, and I hope that the situation continues to get better. I think given the current hydroxychloroquine data, the attention may shift to other potential treatments anyway, and then that will be good. But there's clear benefit in lupus. It's one of our more important drugs that we use actually right now in lupus. I'll maybe just say generally too, we want, this isn't exactly your question, but I just want to make sure that I say it, is that we generally want everyone to continue on your current medications. So we've talked about how we're unsure whether the immunosuppressants would put you at any increased risk of getting COVID. There's a theoretical risk there, but there's definitely a risk from your autoimmune condition and from lupus if you're prescribed medications to control your lupus and you stop them. You could be at risk of a bad flare. And that's sort of a clear and present danger. And so we have been advising everyone to continue taking the medications you've been prescribed for lupus or any other autoimmune conditions. If you have concerns, then contact your physician's office. But the best advice is to keep going with what you've been on to try to keep your lupus in control, because a flare is a real risk for people stopping their medication. And so both in the case of hydroxychloroquine, where we didn't want to run into a shortage situation, and also with other lupus medications, those medications are doing something, and the general advice is to keep on doing what you've been doing for your lupus. Raise any particular concerns with your physician, because there could be some trade-offs in your particular situation, but as a general advice, not to stop all your medications during the COVID crisis.
That's excellent advice, because I've been hearing reports of people actually who have lupus cutting their medication dosage in half. I have not done that, even though I've seen a reduction in how much medication I can get filled at one time. I've had enough, and I would not want to do that anyway. So thank you for emphasizing that we need to stay on our current dosage to the best of our ability.
Yes, it's really important, because lupus is dangerous, as we know, and while there's some theoretical risk of COVID, we don't even know whether the medications you're taking would make you any more likely to get it. Right now, as I'd mentioned, probably the most important thing is trying to be safe through the CDC guidelines, and we'd hate to see people getting lupus because they're reducing their medications, especially if it may not really protect them much from getting COVID or not getting COVID in the first place.
We've seen reports of racial disparities with the COVID infection in the general population. We mentioned earlier that there's also a racial disparity in the population of lupus patients. Are you seeing a correlation between those two disparities? Are there similarities?
Yeah, it's a great question. I'll say again, with the case of lupus, we're not sure um, because we really don't know the denominator of how many people have been exposed versus how many people are getting sick. Uh, to answer the question, are, say, for example, African American or Hispanic American subjects more likely than European American subjects to get COVID in the first place if you had lupus, for example? Um, when you get to the hospitalization, rates and who's become sick with it after having a positive test, we maybe have a little bit of information on that. It doesn't look like it's any different based on your ancestral background or which population you're from, as far as whether you get more severe COVID or not. And so, but that's still early days, and again, we're still collecting that information. Some of the cities that have reported data on the racial disparity in COVID, it's been really striking. So it could be there in our lupus data as well. It might just be that we don't have enough collected yet and we can't see it, or because we again don't know how many people have been exposed yet, really. It's striking. The thing that it makes me think of that's I think probably similar between lupus and the way that COVID hits different populations differently is that we think that these differences probably arise from differences in our immune system. Different world populations, historically, people lived on different continents and wouldn't be able to get on a plane and travel anywhere. And there's evidence that in recent human history, we've had some adaptation to local bugs, viruses, bacteria, things like that, and that where we've lived has probably shaped our immune system. And so this has happened with our ancestors. For most of human history, wherever you were born, you'd probably die very close to there. You wouldn't really travel large distances. And so people's immune systems probably adapted somewhat to their local environment and what bugs you were likely to face. We think that this is what now has translated into some differences in the immune system and therefore differences in autoimmune diseases between world populations. So there are some autoimmune conditions like lupus, which are more common in people of, for example, African American descent, Hispanic American descent, probably also Asian American descent as compared to European American descent. And so that's one of these things where we think there are probably differences in the immune system from the pathogens that our ancestors have fought off and seen. There are some autoimmune conditions that are more common in European ancestry, for example. So it's not necessarily that one population is more autoimmune than another, but sort of the different types of autoimmune conditions vary between populations. So it makes me wonder if this might be similar with COVID. There may be some world populations that maybe have an immune system that's better or worse set up to respond to this, and we might be seeing this in the data. I know, again, even for the COVID data, it seems like early days because not everywhere is reporting their data broken down by population. But where it has been reported in some of the larger cities, it seems to be a very striking disparity, and I think that that's going to be important to follow up.
That was an awesome response, Doc, and it speaks to your knowledge and your work as a geneticist. And so we so appreciate how you tie that into your research. Thank you. This next question for me is to do with reaching out to lupus patients because, our message is we want people to not be alarmed, not be afraid, but to be aware. So we have a two-part question here for you. Number one, it's been great to get this information from you, and we will continue to provide your expert opinion and get the news out to folks out there. And in the meantime, is there a place that folks can go to regarding disease-specific information on how to deal with COVID above and beyond what the CDC is putting out for the general population? And then to follow up with that, I guess my personal questions are in general. What does our future look like? How are we going to address going out into public? What will social distancing be like? What will our lifestyle be like? Will there be hugs? When a vaccine is available, will that be readily available right away to lupus patients, or are there other considerations around that? Just how should we feel about going out into public? So, two-part question, and I hope you have some good words of wisdom for us.
Great. Yes. So I think, with respect to where to go for information, the first part of the question, there have been some nice websites that are available for this. I would say that the Arthritis Foundation, so arthritis.org, has a nice link that you can click on that has information for people with arthritis and autoimmune conditions related to COVID. The American College of Rheumatology is the society that also covers rheumatic diseases, including lupus and other autoimmune conditions. And it's a physician society, but they have a number of nice patient-facing resources as well, and have also recently come up with a consensus guideline about how we should deal with rheumatic conditions in the days of COVID. That's very similar to what I've mentioned so far on the interview. The basic guidelines are that you should continue your medications, and that, consult with your doctor if you're concerned. If you feel like you're coming down with COVID, then reach out right away, and your physician may stop your medications if you have active symptoms. But if you're not actively symptomatic, then you should continue on your medications as planned. And that's really the gist of the guidelines from the American College for Physicians and Patients. But there are a bunch of other sort of nice Q&A sections on those websites. So rheumatology.org and arthritis.org are those two websites. With respect to the second part of the question, how do we get back to normal, and what is it going to be like? I will get there. I want to for sure end on a hopeful note that we've been through a bunch of really serious things as a human species before, and we'll get through this, and we will make it. It is a challenge for sure, and I think it's one of these things that no one, you can never see this coming. It happens, and then you have to react. I think in general, I should, because I haven't done this yet, I should applaud all the first responders and healthcare workers for really getting out there and being the army that's protecting us from this as a population. I mean, that's really we can't give enough thanks for everyone that's doing that. I think after that piece, and after we sort of tend to the health of the population and the people who are getting sick, thinking about the next phase of how do we get back to normal life, I think that we definitely need more information. So some of the antibody testing will be important to see who's actually been exposed and how widely this has already spread. I think that will also be used to determine to some degree a person's safety to return to work if they were to work in a high-risk setting where they were likely to be exposed. So that will be helpful. I think that the general idea is that it's going to come back gradually. Unfortunately, I don't think it's going to be like flipping a switch. I think that we'll remain somewhat socially distanced and then gradually become less distanced over time as it becomes more safe. But really having more information is key to that, really knowing how at risk is the population. I think some of the studies I mentioned earlier about, are there autoimmune populations that are at special risk, the things that we're going to learn from the data we're currently collecting, all that will be important. In the end, everything is a risk-benefit decision, and obviously everyone makes those choices themselves, even when they decide how well to adhere to social distancing and things like that. I think we want to give the public the best information, really push the information in the science, and base our public policy decisions on science the best that we can. I think that's going to be critical. I think not doing that really puts us at risk again. And I think one of the things that is important to think about if we think about going on the fast side is that there's some risk of additional outbreak, and that could be a setback where you actually have to go back to more strict, measures again. So I think those are a lot of the considerations. I can't say that I know a time frame for sure. I can say that in New York City, we're planning to remain in a fairly shut down state at least through mid-May. We've luckily passed the main surge of cases now. I think it's safe to say that, although there are still sick people coming in every day. But it's a lot better than what it was at the peak. So that's good news, and I think that there are some also other spots of good news from around the country and other places where they've seen a surge and then seen it level off and start to decrease. So I think there are promising signs, but I think we have to continue collecting the information, try to put together the best policy that we can together based on the data, and then I think there will be hugs again. I can't skip that part of the question. There definitely will be hugs again. We're going to get back to normal life, and I think that those are the factors around social distancing, and then when we can get something even better like a vaccine, then I think then that will really open things up. I guess in part of your question you mentioned, lupus patients and priority for vaccine. It's hard to know for sure, but a lot of times in this type of a setting, like when we get our first batches of flu vaccine, we try to apply it to the people who are at greatest risk. And so we generally consider people, say they're taking immunosuppressive treatments, in a category of people that we would call first. It's hard to guarantee what everyone will do all around the country, but I know that's a general process that a lot of people will use, is they'll try to look throughout their patient population and decide who would be most important to each first. With vaccine, of course, the idea is that we just want to get it to everyone, and that hopefully the first person to get it and then the millionth person to get it won't be that far separated in time, ideally.
So something I'd also really like to ask you, and I'm sure a lot of people are interested in, is in terms of COVID, what can we do in terms of diet and exercise?
So it's a good question. With respect to anything that's particular to COVID, I'll say we don't have a real magic bullet there, with diet or exercise, particular supplement that can prevent COVID. But it's an important question because all of our lifestyles have changed quite a bit. And it is important to maintain your general healthy practices. So with diet, it's important to do your best to continue to eat a good balanced diet with lots of fruits and vegetables as you can. I know that in some cases it may be difficult if you are not able to go get food, or if you're relying on either a friend or relative to deliver, or a delivery service, and then what they have available. But just keeping in mind that you'd like to continue good general healthy eating practices, that does help support your general health, including your immune system. Likewise, exercise is important, and it can be a little more challenging if you had an exercise routine that took you out of the house to a gym, or jogging through the neighborhood, or other things that you may be less likely to do now. So there, it's important to try to be creative. I know that there are many online and television-based resources. People have ramped up their efforts to provide gym-like services or exercise videos or things like that, both free and for pay, so that you can stay active. But it is important to try to stay active because a good exercise schedule also helps keep your body and your immune system healthy. So I know both of those things can be a little more challenging now, but it's a good place to devote some energy to maintain your general health through the social distancing period.
Right on. That is excellent. Thank you for encouraging us to the best of our ability, maintain a healthy lifestyle through what we eat and how we move our bodies. So thank you.
And exercise is good for both your mental and physical health. We're all cooped up inside for so long.
Definitely true. Definitely true.
So are there any topics that we did not hit on in regards to autoimmune and the COVID situation that you feel needs to be needs to be mentioned?
Let's see. I think we hit most of it. The hydroxychloroquine is definitely a hot button issue. What to do with your medications, and the Cytokine Storm. Those are the top three. It seems like they come up a lot. You know, those are really questions that people have that really hit the autoimmune and the COVID at the same time. You know, specifically. I think that's pretty good. I'm just trying to think if there's anything else that might be helpful. But that's a lot of it now. I'm hoping that we may have some more antibody testing data available. New York City did a survey, and it was, you know, there are a bunch of caveats. Again, it wasn't huge, and we don't know exactly how accurate the test is, but it suggested that 21% of people in New York City had been exposed to COVID. Which is impressive. That would be more than 1 million people. And it would suggest that our current testing is capturing maybe 10% of the people who've actually had it. So I think that might be a good one for next time.
Only 10%.
We'll have more information, but yeah, I mean, I think it's probably because we can't test anybody who's not got symptoms. We've really had to limit our testing to people who are really sick. I think in some ways that's encouraging because right now, if you just do the math for the number of positive versus number of people who've died of the virus, it's like 5%, which is really scary, and that's higher than a lot of other places in the world. But I think it's because we're testing only the really, really serious cases that come into the hospital. For people with mild symptoms, the general advice has been to stay home, actually. So you might have COVID. If you come in and get tested, then someone's got to get right in front of you and do the thing up your nose, and you're exposing someone. And if you feel like it's just like a cold and it's not bad, then you know, there isn't a good way to test besides that swab. And so they've been telling people to stay home. You know, I don't know, you know, who knows if it's the best thing. It's just what we can do right now. There's a limited number of tests. So I think good news in that is that if that math is right, then it would be less than 1% of the people that are getting COVID that are actually having really serious bad outcomes from it. And that would be good news. And the other part is that it would mean that we're maybe farther into this than we think, you know, and there might be a bunch of people walking around that already have some defense against it now, which every time there's a person in the, you know, they talk about the herd immunity, you know, that every time there's a person in the herd that's immune, it can break a chain of transmission, you know, so you could have someone that could have passed it, and then if they stop it, then maybe that stops there, you know, and so all those people help us not get it. I'm trying to think what else to talk about. I guess, well, we didn't mention face masks at all. I guess that could be something that we could talk about a little bit, because it's a common question. If you want to maybe, I mean, I guess asking you to ask me a question. You want to ask a question about that, and then I can then I can do a face mask response. Okay.
You take this one, Dietz. Your turn.
Okay. So it's been suggested and asked that people going out wear face masks, you know, personal protective equipment, gloves. What sort of things are effective and aren't effective? We're seeing homemade masks, and I've seen people in the grocery store wearing just the rubber kitchen dishwashing gloves. What is recommended? What is effective? What is not effective?
That's a great question. I'll say that our guideline in New York City has been to wear a face mask when you go outside and are going to be around other people. And that's been the general guideline that we've been living under now for a few weeks. I think that's a good general one, and probably could be applied in many other places. I think it's very poignant in New York City because the population density is so high. You have to ride elevators. You can only fit so many people 6 feet apart when you come to a crosswalk. There are a number of things that are kind of hard to socially distance, you know, when the population's that dense. as far as what's effective with the face masks, I mean, there are medical ones, of course, but we've generally been told to avoid those in the general population because we really need those on the front lines with healthcare workers and frontline people. And so other things, it seems that cotton is fairly effective. A combination of cotton with a coffee filter like paper, either one that's made commercially or one that you make yourself, seems to be fairly effective. In general, something that would cover the nose and mouth and provide some protection. I'll say that with face masks, it's really important you're also really doing it for other people. I think it's one of these things that's maybe a little bit hard to explain, but when you wear a face mask, if you cough or sneeze, then you don't spread as many infectious particles and for not as large a distance or as great an area. If everybody's wearing face masks, then even the people who have it and don't know it will be less likely to transmit it. And that's probably the biggest benefit, honestly, from face masks. There are news stories, and I think they're true, that most of these face masks, especially homemade face masks, are not going to be 100% effective if you were exposed to a large burst of coronavirus. And that's true, unfortunately. But having something that you can do to help yourself and help everyone else is really positive, and we've been encouraging this because, again, it really helps us all. When people are all wearing masks, it just makes all of us less likely to transmit it. And unfortunately, we really don't know. You can have it and be asymptomatic, meaning no symptoms, and it's been shown that you could transmit the virus. So unless you apply this to everyone, then it's not going to be as effective. So that's really, I think, the best advice about face masks. I think gloves are fine as well, and avoiding contact. I think that's also a wise idea. I'll say that in New York, some of the places of business have done a really good job with this. I've seen stores where they actually have cotton swabs available, so you can press the keys on the pin pad for the credit card payment instead of having to use your finger. Of course, wearing gloves provides a similar level of distance between you and contact. So that's, I think it's good general policy. I think depending on where we go as time moves on, the face mask policy may be able to be more lenient, but I think for right now, where some areas are experiencing some of their peaks or have just gone through, that makes a lot of sense to try to prevent transmission.
So, Doc, one of the things the Lupus Research Foundation has been involved in is your very exciting research project, the PNP enzyme project. Can you let us know, give us an update as to how that's going, and also how your dendritic cell project is going?
The PNP project, this is one Yogita's been doing, and she has moved this along to a good spot where we're seeing the effect of the gene variant in human cells, and we're starting to get an idea of how it turns on the interferon pathway. The next step, and this has been supported by the LRF, is that we wanted to make a mouse model, mostly so that we could start testing whether you could reverse it, or the therapeutics you could use. And so you always have to start in the mouse when you do that. The human cell systems are okay, but you can't test things like how an organ responds, if you just have a few cells from the blood. So that work is a little bit slower because the mice were being made as this all hit. But what I've heard is that they're still working in the mouse, have sort of a reduced number of people. So we're hoping to get the mice hopefully over the summer. I think we'll be back open by then and going, and then see how that goes. So that's exciting because that would give us some idea if you were to go at a whole body system. How can you improve, for example, the kidney disease that you would see and things like that.
Awesome. Okay, well, good luck with that one. That's great that it's still moving, in the right direction. And as I know you anticipated, but I know you've said in research sometimes it's 2 steps forward and 1 step back, or the opposite. So that's wonderful. Glad to hear that.
Yeah. Or they close your building for COVID, or who knows, life is like that, right? But we'll be back.
Yeah.
It's a temporary, it's a short-term deal. We'll be right back at it. So, And it has
Yeah.
given us a chance to look at some of the previous findings and analyze data that's been waiting in the spreadsheet, so there's been plenty to keep people busy, luckily, and everybody's sort of been industrious at home. So, yeah.
That's awesome. Awesome.
I have to say, as a patient, a lupus patient, and somebody who is immunocompromised, I am hopeful that some of these preventive measures will stick around once the threat of this illness is gone. The lupus patients and the people that have been compromised have been kind of practicing this for years already, right? You're already aware of every illness. We wash our hands and we practice a little bit of social distancing, and we're aware of infection. So I really hope some of that sticks around after the major threat is gone.
Yeah, it's a good point because I think some of these CDC guidelines, like the guideline around hand washing, you could say that mother always told you to do this already, and so I think it is generally good practice for people who are immunocompromised, and I think it actually does reflect kind of probably somewhat of a lack of awareness in the general population that serious infections are out there, and in the case of COVID, we're observing this on a grand scale, unfortunately, and that these things can happen. But it's true. I think that you're exactly right that people who've taken immunosuppressive medications have already been thinking about these issues, probably in a greater degree than many of us in the general population have been. I know as a physician who frequently prescribes immunosuppressive medications for patients, it does come to front of mind and trying to think about how to be proactive and prevent infections. So I think you're exactly right, is that some of these things will probably stay, and it's probably a good idea. I think some of the really restrictive things will ease because we are a social species and we'll want to interact with each other. But some of this is just good general practice, and it's I think this has been kind of a wake up call, and that some of it will persist.
I agree, and I hope that some of the new practices will hold true as well. I know we do those at home. As soon as we come home, we change into our at-home clothes. Usually, wash the clothes we were wearing, and of course, wash our hands first thing when we come in the door. And washing hands as soon as we came home was something that we've been doing for years, and washing groceries, and of course, taking shoes off. And I think that's helped me prevent colds, and I hope all of us will stay healthy and our loved ones will stay healthy as well. But Dr. Niewold, that was awesome. Thank you so much for the positive information and arming us with things we can do. So what I hope to do is follow up with you and meet with you again. And as we do receive that data regarding outcomes and antibodies in terms of people with autoimmune disease as well as the general population and how it forms how we should move forward, catch up with you again and re-up with all of our viewers and all of our wonderful friends and supporters.
Yes, that would be great. Thanks to you for all of your support and for putting this together. And I'd be happy to meet up again and try to get the latest information out there.
Cool. Well, thanks. And thank you for all your wonderful work to help people in the world and lupus patients. And we look forward to working with you and talking with you again in the future.